Have you ever had a blood test that included a C-reactive protein or CRP test? Did you get your results back and now you're wondering what they mean? In this video, I'll explain everything you need to know about the CRP test, including what it's used for, what the results mean, and some of its limitations. Let's get started. Section 1. What is a C-reactive protein test? C-reactive protein, or CRP, is a substance produced by your liver. Normally, the amount of CRP in your blood is very low. But when there's inflammation, whether from an infection, injury, or chronic disease, the liver produces more CRP and the levels in your blood rise. Section 2. Why is the CRP test done? Doctors order a CRP test when they suspect inflammation or infection. It helps in detecting bacterial or viral infections, monitoring autoimmune diseases like rheumatoid arthritis or lupus, checking for heart disease risk, and tracking how well treatment for inflammation is working. Section 3. How is the test done? The CRP test is very simple. A blood sample is taken from your arm and sent to the lab. The lab measures CRP levels and results are usually available within hours. Section 4. Normal vs high CRP levels. So what do your CRP results mean? Well, it helps to first understand what's considered normal. Normal CRP levels are usually less than 10 milligrams per liter. A mild increase may indicate a minor infection or inflammation. For example, a recent surgery or dental work can cause a temporary increase in CRP levels. Higher levels, such as 20 milligrams per liter or more, can suggest a more serious infection or inflammation, such as pneumonia, an autoimmune condition like rheumatoid arthritis, or even cardiovascular problems like atherosclerosis. However, it's important to remember that CRP isn't specific to any particular condition. An elevated level doesn't tell us what the cause of the inflammation is. It's like a general alarm that something is wrong. That's why it's important for doctors to interpret your CRP results along with your symptoms, medical history, and other lab tests. Also keep in mind that different labs may have slightly different reference ranges for what's considered normal, so always check with your healthcare provider for specific guidance. Section 5. CRP vs ESR. You may have also heard of the ESR test, which stands for erythrocyte sedimentation rate. It's another blood test that's sometimes used to detect inflammation. The ESR test measures how fast red blood cells settle in a test tube. When there's inflammation in the body, the red blood cells tend to fall faster. Both CRP and ESR can be helpful in detecting inflammation, but CRP has some advantages. It rises and falls more quickly than ESR, so it's a more sensitive marker for changes in your health. For example, if you have an acute infection like a pneumonia, CRP levels may be high at first and then drop quickly once the infection is treated. ESR levels, on the other hand, may continue to be elevated even after treatment because they are slower to respond to changes. Section 6. Limitations of CRP. Although CRP is a useful tool, it does have some limitations. It's not specific. It only tells us that there is inflammation present. It doesn't identify the exact cause. So it's important for doctors to consider a patient's entire medical picture when interpreting the results. Also, factors such as age, pregnancy, and certain medications can affect CRP levels. In children under 5 years of age, CRP levels are higher than in adults. During pregnancy, CRP levels can also be higher. Certain medications like corticosteroids can lower CRP levels. So it's important for your doctor to know all the details in your situation before making a diagnosis. And that's a wrap. We hope this video was informative and helpful for you. Remember, understanding your lab results can be confusing, but we're here to help. If you enjoyed this video, please hit the like button and share it with your friends. Don't forget to subscribe to our channel for more medical education videos. Thanks for watching, and we'll see you next time. Hey guys! I hope you're enjoying this channel so far, and I hope you subscribed already. If you didn't do it, and if you did, watch this video right there. I think that will help you too.